Good morning, and today I'll be presenting about the Zika virus and its etiology. But first, let's start with its case study. This is the patient profile. The patient is female and is 28 years old. Her occupation is a teacher, and the location was that she recently traveled to Lopburi, Thailand, and was known to have an outbreak of Zika. On the first day, she returned from a 2-week vacation in Thailand, and she experienced mild fever, headache, and joint pain, which is also symptoms to travel fatigue. But on the second day, she develops a rash that spreads from her face to the rest of her body along with conjunctivitis. And then later on, she reported it to her physician. And then she also reports having traveled recently to Brazil, where the virus is also endemic. She also mentioned mosquito bites during her stay, and the patient is also known to be sexually active and uses mosquito repellents intermittently.
So, a brief definition about the Zika virus. The Zika virus is primarily transmitted through the bite of an infected Aedes species mosquito. It can also be transferred through sexual intercourse, and the infection for pregnant women can lead to certain birth abnormalities such as microencephaly, and there are also no currently specific treatment or vaccine that is available to prevent Zika virus infection. The most common signs and symptoms are rashes from the face to the body, fever, conjunctivitis, muscle and joint pain, malaise, and headaches. So, for a brief overview of the clinical and public health history of the infection, the first case has a 31-year-old woman with a upper respiratory tract infection in 2010, which was 2 years ahead of the Zika virus case that was officially reported in the Philippines. The second one has a 15-year-old boy in Cebu who had a subjective temperature in May of 2012. His signs and symptoms are similar to the common symptoms of the Zika virus listed earlier. The third one reveals a case in September 2016, where there were 17 confirmed cases of the Zika virus that were reported in the Philippines. A month before the illness started, none of the individuals had ever traveled to a country that was impacted by the virus. The last case talks about in February 2017, where a total of 57 Zika cases were reported, but unfortunately, there were no reported deaths. These are the areas that were infected. In the NCR, there were 20 cases. In Calabarzon, there were 18. Western Visayas, there were 15 cases. Central Luzon, 2 cases, and Central Visayas, 2 cases. Out of the 57 cases, there were 7 to be confirmed for the women that are infected with the Zika virus that were pregnant. So for the differentials, there are dengue, chikungunya, rubella, and measles. And for the diagnosis tools, which I also stated, you're using PCR, IgG serology, IgM titers, and RT-PCR. And the imaging techniques also include chest X-ray, ultrasound, MRI.
So for the clinical impression, the patient reports a history of recent travel to Brazil, which is where the Zika virus is endemic to. And during her stay, she experienced mosquito bites and intermittent use of repellents. Furthermore, she disclosed being sexually active, which may influence her exposure profile. And then for the gold standard diagnosis, we used RT-PCR. And for the gold standard treatment, or the drug of choice, sadly, it is supportive. And to alleviate the symptoms, we recommend rest, fluid, usage of analgesics and antipyretics. For the immunogenic testing, we use PCR. And lastly, for the risk factors associated with infection, it is very dangerous for infected pregnant women and also for sexually active individuals. And lastly, and importantly, the transmission through infected mosquito bites, especially for the Aedes mosquitoes.
So for a brief demography for prevalence and incidence in the Philippines, there were 70 confirmed cases of the Zika virus, and in Iloilo, the index case was discovered on the date of September 2, 2016. And furthermore, since none of the 17 confirmed cases had ever traveled to a Zika-infected countries before they fell ill, it is likely that the illnesses were spread locally. Lastly, for the mortality and the morbidity reports during the 2016 outbreak, there were no recorded deaths in the Philippines that was especially linked to the Zika virus infection. The morbidity rate is very mild and the majority of individuals showed flu-like symptoms, and a small number developed complications such as the Guillain-Barré syndrome, which is a neuro syndrome. In the levels of interventions, the primordial intervention is to reduce mosquito breeding places by disposing of contaminated water. And for primary prevention, it is encouraged for the use of insect repellents, also for mosquito repellents, and to raise for health awareness campaigns. The secondary prevention, on the other hand, encourages pregnant women to seek prenatal care and testing, and to make sure that the early diagnosis and surveillance is effective. Lastly, the tertiary prevention is to monitor the person that is infected with the Zika virus for long-term health effects, such as the congenital Zika syndrome and the Guillain-Barré syndrome in adults, and provide supportive care to manage their symptoms.